How we do that, that's why I've asked Laura Packard to come talk with us. Laura's a stage 4 cancer survivor, healthcare advocate, and host of the weekly ACT TV program, Care Talk. Laura, thanks for taking time for us.
Thanks for having me.
So, I look at this Bill O'Reilly bit. How dare he ask those rich people to pay more so that those families paying $1,000 a month for insulin can get off with $35. How dare they?
Well, I think that Bill O'Reilly has plenty of spare dollars he could be paying. I think that it's ridiculous that we're not taxing the rich in this country, and we could afford so many things for so many Americans, like healthcare, if we finally tax the rich and greedy corporations.
Now, what's interesting, I was looking at this report put out by the folks at Scientific America, and they wrote a story on this most recent findings published at the Proceedings of the National Academy of Sciences, USA. And what they found, not surprising to you or me or any rational, reasonable, thoughtful person, is that they found from the beginning of the pandemic until March of 2022, if we had a universal healthcare system, could have saved what they're saying 338,000 lives from COVID. Probably wouldn't have had the dramatic effects that we had if we just had a system of care that would have helped us get through it. It wouldn't have been as devastating.
Well, too many people right now don't have insurance, or they can't afford to use insurance they have with high copays. And this is a matter of choices. Our budget and how the United States spends our money is about choices. And every dollar that Bill O'Reilly uses to build an elevator, a car elevator, or buy a fifth house or a 10th yacht, those are dollars that are not being used for the things we care about. We are all paying for the tax breaks that the rich are profiting off of. And again, it's a matter of choices, and we need our elected officials to make better choices.
Now, they say that prior to the pandemic, there were 28 million people who were uninsured. And this is, look, I supported the ACA. It's something I thought was important. It's a good first step. It's getting us down the road to ensuring people have options and to get health care. Still had 28 million people who were uninsured. Because of the pandemic, another 9 million lost their insurance, that wonderful employer-sponsored health insurance that everyone claims that they love, but most people tell me, I get it because that's what I got. You added 9 more million people to it. So I'm telling you, I'm looking at 338,000 lives going, I'm surprised it's that low.
Yeah, well, I mean, all of these are guesses because, there are no figures to say this person died because they didn't have health insurance. So they're working with statistics and estimating and so on. But we really have no idea how many people can't afford to get the insulin they need, and they ration their insulin, and people die. We don't know how many people can't afford the copay, didn't go in for preventative cancer screening, and came down with terminal cancer. We don't know how many people are not able to get the care they need to stay alive, or just the care they need to be healthier, happier Americans.
Now, you bring up the cancer screening, and I know you're a cancer survivor, stage 4 cancer survivor. But I remember, several months after the Affordable Care Act was passed, we had done a food drive, and a couple came up to our encampment there where we were doing the food drive. And the guy told me the story that because of the ACA insurance he got, he was able to get the cancer screening that he would have never gotten because he didn't have insurance. And it literally saved his life. And this is, going back to the beginning of this. And I always remember that because it's that preventative care right from the start that helps catch things early. He said, look, we caught it early enough that I was able to have it treated. And, I've gotten all this extra time, and I hope he's still doing all right. I haven't heard from him since, but, it gave him a chance. And that's all I think we can ask for.
Yeah, and also the way that we spend our money in our healthcare system today is the poorest choices, because you could spend a little bit upfront to get people the preventative cancer screenings they need, or you can spend a lot in treating somebody at the hospital where they arrive because their cancer has spread, and then they could spend weeks in the hospital and then die. So we have worse outcomes, and we pay too much for it. Whereas if we just covered everybody, we would be so much better off.
And the thing is, it's not even just cancer. I mean, cancer is the big one, obviously. I mean, it's something as simple as, we've got millions of Americans who have got diabetes. And it's one of those things where, I've known people who have had to make choices between insulin and food, between testing supplies and paying their bills. And that's insane, because if we can get this stuff to them at a reasonable cost, I think $35 a month is reasonable. If you can get them to that, to where they're getting their insulin, you know what maybe we're not doing? Maybe we're not going and having surgeries chopping things off of people. Maybe they're able to be productive workers while still having these ailments, and preventing the really ugly, horrible stuff from happening. For me, first and foremost, because I'm empathetic and I don't want people to have to go through this, but if I have to be cold-hearted and mean, because it's freaking cost effective. It's going to be cheaper in the long run to go, here, take your insulin so I don't have to chop your feet off and pay you disability. Thoughts?
Yeah. Well, I agree that the way that we're spending our money, it comes back to choices, and those choices are not turning out well. However, I got good news and bad news.
All right, good news.
The good news is that even though legislation that the House passed at the end of last year, Build Back Better, it ended up not going anywhere in the Senate. There is word that people are talking behind the scenes that there could still be something, a package we see in the next month or two. We'll see. I know that you've been skeptical in the past, but we'll see. There could be a package, and it could include lower prescription drug prices, and it could include making sure that Affordable Care Act insurance plans stay affordable, because right now, a lot of people are going to get unpleasant bills in the mail in October.
And duh, we need it. I mean, this is one of those things that the people want this stuff. This shouldn't even be there shouldn't be a discussion. It should be done. It should be done already. This is the problem I have with our system. And I think this is why, in talking with some conservatives, who are honest conservatives, who go, look, I'm afraid of a government-run system, a universal system, because of these kind of things where you're going to get politicians who are going to hold things up, and we're going to be hostage to these situations because our politics are broken. And this is one of those things where even Social Security, the fact that Rick Scott can come out and say, you know what, we're going to suspend all federal programs every 5 years, and maybe we'll do them, maybe we won't. And nobody's hair on fire wanting to get this guy thrown out is bizarre to me.
Yeah, well, I mean, I think that people for a long time have thought that politicians, elected officials, were just talking, because it's true. They make a lot of promises and they don't always deliver. Republicans have been running on the idea of getting rid of Roe versus Wade, the right to an abortion, for decades. But they're almost there. The Supreme Court is going to come out with a ruling any day now that is going to end abortion in half the states. So eventually they will execute on the things that they talk about. And people should absolutely take seriously what Rick Scott says, because he says what the Republicans want to do, which is cut Social Security and Medicare. And if you think he's just talking or he's not serious, guess what? If they have the chance, they will do that.
Yeah, boy, will they. You're listening to The Rick Smith Show here with Laura Packard, stage 4 cancer survivor, healthcare advocate, host of the weekly ACT TV program, Care Talk. Make sure you check out the program she does. We'll get links out. You can check that out, acttv.com. So you brought up abortion. The dog is clearly going to catch the car, I believe. And they're going to chew the bumper off, and they're going to chew into the car to go after the women in the back seat. Is this going to matter to this November? Because I got to tell you, there's part of me that goes, if this were something that were affecting me and affecting men, I would expect to see lots of outrage. I see some, but I don't know that I'm seeing as much as I would want to. Is it shock? I'm curious where your thoughts are.
I think a lot of people don't believe that it's really happening. Just like what we were saying before, when they say they'll do something, they really will try to do it. And there are over 100 people that were involved in the insurrection that are running for office. There are Republicans running around basically saying they don't believe in free elections anymore. And if they are elected, they will dismantle our elections. when elected officials, when candidates say something, you've got to take them seriously. You can't just listen to the parts you like and ignore the parts you don't like, because eventually the chickens will come home to roost, and we'll see that with the Supreme Court.
Yeah, well, I find it interesting as people are willing to give up that whole democracy thing as long as the person that you're giving it up to is doing things that you want them to do, without thinking that someday you're going to be in the Shark Tank. Someday they're going to do something you don't want them to do, which is, interesting times ahead.
Absolutely. I mean, I think that Russia was in bad straits when Putin came to power, and I'm sure that a lot of people voted for Putin, thinking, well, he talks a good game. We'll see what happens. But if you put dictators in power, they dictate. You may like some of what they have to do, but a dictatorship is not a safe place for anyone to be long term.
Scary, scary times ahead, but I know we'll keep fighting, Laura. I appreciate the time, the work that you do. Important stuff. Thanks so much.
Thank you.
Our good friend Laura Packard. Make sure you check out the work that she does over at ACT TV, her program Care Talk. Take a look at that. Also the podcast, wherever you get your podcast, check that out as well. Love to hear your thoughts. Email me, Rick at thericksmithshow.com, or give us a call, 1-866-416-RICK, 1-866-416-7425. This is The Rick Smith Show, where working people come to talk.